Welcome back to In Focus, and it's time now for our Africa Health Network update. And health reporter Linord Moudou joins us now with some news about cholera in Guinea and child malnutrition in Malawi. Hi, Linord.
Hello, Dimiake. Hello, everyone. First, let's start with some scientists. They are warning that the H5N1 bird flu virus could change into a form that's able to spread rapidly between humans. Researchers have identified 5 genetic changes that could allow the virus to start a deadly pandemic. They say it will be theoretically possible for these changes to occur in nature. The study was published in the journal Science. We turn now to cholera, and a recent outbreak in Guinea's coastal community of Bofa has mobilized the government and Doctors Without Borders, MSF, to try a new approach to cholera treatment and prevention. MSF decided to try a cholera vaccine during the epidemic to prevent further spreading. The cholera vaccine has so far only been used in epidemic zones as a prevention measure before any outbreak. This is the first time the oral vaccine is being used in Africa during an epidemic in a bid to contain the disease and prevent it from spreading inland. Experts say it does not guarantee 100% immunity to individuals, but communities benefit indirectly from so-called herd immunity. This means that the effectiveness of the vaccine is multiplied if it is administered to a significant portion of the community, reducing the chances of contagion. An MFS project manager says these new measures are necessary in the face of new circumstances.
The cholera epidemics are getting bigger and bigger in the last years. They are lasting longer, and the intervals between epidemics are getting shorter. And in fact, in MSF, we intervene in all the major cholera epidemics.
We want to get a better idea of the impact of the vaccination in the Bofa district through the data collected in the surveillance. We reinforced the surveillance in Bofa. We will try to do the same in Boke in case we suspect cholera cases in Foricaria. This will allow us to see if we record fewer cases in the Bofa prefecture in comparison with other prefectures where we did not vaccinate.
And beyond vaccination, spreading awareness on proper hygiene practices is crucial in preventing the disease. Local health officers are encouraged to hold training sessions to raise awareness on the importance of the use of latrines, hand washing, and drinking boiled or treated water. Haja Aissatu Balde is one of the trainers.
We need to educate the population. We discussed with communities, and we are spreading the messages through mosques, notables, and local elected officials in order for them to help us with the sensitization. This is our weapon. For this vaccination campaign to be successful, we need to put hygiene rules in place. When these measures are implemented, we will be able to get rid of cholera, but as long as this is not the case, despite vaccination, cholera will remain.
And over 117,000 people have been vaccinated, and surveillance systems in Bofa have been strengthened to enable MSF to monitor the epidemic and to assess the effectiveness of the vaccine over the next 6 months. Now to Malawi, where child mortality is dropping following an initiative that sends healthcare practitioners into remote areas where many residents are unable to afford hospital fees.
32-year-old health worker Blessings Makono has been up since 8 a.m. He is conducting a village clinic outside his brick house in Chipanga village in Chisi, Malawi. A small group of women have gathered here with their babies, awaiting consultation and treatment. Mwanaisha Lubeni is a 29-year-old mother of 4 who is worried about one of her children.
The reason I came to this village clinic today is because my child has a fever and is complaining of stomach pains.
After an examination, Makono determines that 4-year-old Awisha is showing signs of anemia and malnutrition. But more importantly, Makono has diagnosed Awisha with malaria, and he immediately administers the first dose of anti-malaria drug. He also gives her mother, Lubeni, additional medication to take home with strict instructions.
I assist the children in some of these diseases like diarrhea, pneumonia, eye infection, and some other simple diseases. When I find more complicated diseases to the child, I refer them to Kombeza Health Center for further management.
Makono is one of 2 health surveillance assistants working in Chipanga village. The HSA program has contributed to a significant reduction in the country's child mortality rates, especially with diseases like malaria, diarrhea, and pneumonia.
If it was not for this village clinic, my family and I would have to travel very long distances to get the proper health care needed, and getting to the next health center would mean I would have to pay $3 for each trip. What I like about this village clinic as well is that unlike busy hospitals, here you get attended to very quickly because of the small number of patients.
Along with his colleague, Makono holds a village clinic every day of the week. He uses tools and medicines from a kit provided by UNICEF that contains antibiotics, anti-malaria tablets, oral rehydration salts, and zinc. With the nearest health center 18 kilometers away from Chipanga village, these mothers say they are grateful to be able to receive health care closer to home.
And that's all we have for today. And for more information on any of today's health stories, be sure to visit our website, africahealthnetwork.com. And back to you, Vincent Dimiake.
Well, thank you so much, Linord Moudou. And for our audience, please be sure to watch Linord Moudou's Africa Health Network reports every Tuesday and Thursday right here on In Focus.